Question 1. The nurse analyzes the laboratory results of a child with hemophilia. The nurse understands that which result will most likely be abnormal in this child. 1. Platelet count. 2. Hematocrit level. 3. Hemoglobin level. 4. Partial thromboplastin time. Explanation. Question 1. Rationale. Hemophilia refers to a group of bleeding disorders resulting from a deficiency of specific coagulation proteins. Results of tests that measure platelet function are normal. Results of tests that measure clotting factor function may be abnormal. Abnormal laboratory results in hemophilia indicate a prolonged partial thromboplastin time. The platelet count, hemoglobin level, and hematocrit level are normal in hemophilia. Test-taking strategy. Focus on the subject, laboratory tests used to monitor hemophilia, and note the strategic words, most likely. Recalling the pathophysiology associated with this disorder and recalling that it results from a deficiency of specific coagulation proteins will direct you to the correct option. Question 2. The nurse is preparing home care instructions for the parents of a 10-year-old child with hemophilia. Which sport activity would the nurse suggest for this child? 1. Soccer. 2. Basketball. 3. Swimming. 4. Field hockey. Explanation. Question 2. Rationale. Hemophilia refers to a group of bleeding disorders resulting from a deficiency of specific coagulation proteins. Children with hemophilia need to avoid contact sports and to take precautions with other sports, such as wearing elbow and knee pads and helmets. The safe activity for them is swimming. Test-taking strategy. Focus on the subject, a safe activity. Recalling that bleeding is a major concern in this condition, eliminate options 1, 2, and 4, because these activities are comparable or alike in that they present the potential for injury. Question 3. The nursing student is presenting a clinical conference and discusses the cause of beta thalassemia. The nursing student informs the group that a child at greatest risk of developing this disorder is which of these? 1. A child of Mexican descent. 2. A child of Mediterranean descent. 3. A child whose intake of iron is extremely poor. 4. A breastfed/chest-fed child of a parent with chronic anemia. Explanation. Question 3. Rationale. Beta thalassemia is an autosomal recessive disorder characterized by the reduced production of one of the globin chains in the synthesis of hemoglobin. Both parents must be carriers to produce a child with beta thalassemia major. This disorder is found primarily in individuals of Mediterranean descent. Options 1, 3, and 4 are incorrect. Test-taking strategy. Focus on the subject, the child at greatest risk for beta thalassemia major. Think about the pathophysiology of the disorder. Remember that this disorder occurs primarily in individuals of Mediterranean descent. Question 4. A child with beta thalassemia is receiving long-term blood transfusion therapy for the treatment of the disorder. Chelation therapy is prescribed as a result of too much iron from the transfusions. Which medication would the nurse anticipate being prescribed? 1. Dalteparin. 2. Meropenem. 3. Metoprolol. 4. Deferoxamine. Explanation. Question 4. Rationale. Beta thalassemia is an autosomal recessive disorder characterized by the reduced production of one of the globin chains in the synthesis of hemoglobin. Both parents must be carriers to produce a child with beta thalassemia major. The major complication of long-term transfusion therapy is hemosiderosis. To prevent organ damage from too much iron, chelation therapy with either deferoxamine or deferoxamine may be prescribed. Deferoxamine is classified as an antidote for acute iron toxicity. Dalteparin is an anticoagulant used as prophylaxis for postoperative deep vein thrombosis. Meropenem is an antibiotic. Metoprolol is a beta blocker used to treat hypertension. Test-taking strategy. Focus on the subject, chelation therapy. Specific knowledge regarding the antidote for iron toxicity is needed to answer this question. One way to remember this is to look at the prefix in the generic name of the medication used to treat iron overdose. Remember to associate defer and removal of iron. Question 5. The clinic nurse instructs parents of a child with sickle cell anemia about the precipitating factors related to sickle cell crisis. Which, if identified by the parents as a precipitating factor, indicates the need for further instruction? 1. Stress. 2. Trauma. 3. Infection. 4. Fluid overload. Explanation. Question 5. Rationale. Sickle cell crises are acute exacerbations of the disease, which vary considerably in severity and frequency. These include vaso-occlusive crisis, splenic sequestration, hyperhemolytic crisis, and aplastic crisis. Sickle cell crisis may be precipitated by infection, dehydration, hypoxia, trauma, or physical or emotional stress. The parents of a child with sickle cell disease would encourage fluid intake of 1.5 to 2 times the daily requirement to prevent dehydration. Test-taking strategy. Note the strategic words, need for further instruction. These words indicate a negative event query and ask you to select an option that is an incorrect statement. Recalling that fluids are a main component of treatment in sickle cell anemia to prevent crisis will direct you to the correct option. Remember that fluids are required to prevent dehydration.